I'm Professor Kim Yemi of Conservative Dentistry at Ewha Women's Mokdong Hospital. Today I'm going to talk about survival rate of a cracked tooth of a tooth that has gone through endodontic treatment. The definition of cracked tooth may vary, but in general, we call cracked tooth as incomplete fracture following the tooth axis from the occlusal surface. In order to diagnose it, I use methylene blue or transilluminator. The difficulty is to find the crack, and it's difficult to understand the depths and anticipate the prognosis. I started this study in order to analyze the crack tendency and the survival rate of a cracked tooth which has gone through root canal treatment. Also, I'm going to look at the factors that affect the consequences. Analysis was done following the AAE classification. First is the crease line, where the crack is limited to enamel and there's no pain. Cracked tooth that we all know. Split tooth, where the incomplete fracture becomes complete. Fractured cusp is when the complete fracture occurs only on one cusp. And vertical root fracture, where the crack progresses from the apex of the root to the coronal surface. These were the classifications. The ratio of the cracked tooth was the highest in this study. This looks slightly complicated, but AAE included a complete fracture because incomplete fracture leads to complete fracture. If we divide by gender, age, and tooth position, as anticipated, crack occurrence was meaningfully high in age groups 50 and 60s, and it occurred frequently in the second molar, the 2-year survival rate of cracked tooth which has had a root canal treatment. It was 90%, and I analyzed the different variants. The direction and progression of crack, the probing depths, pain, gender, tooth position, and whether it has been treated or not, and the form of oral cavity was assumed to have influence. The results showed that if PPD was over 6 mm, the survival rate was significantly lower. When PPD was less than 6 mm, the survival rate was 96.8%, and if it was above 6 mm, it was 74.1%. I'm going to talk about the conclusion. Lower second molar was more prone to crack occurrence. The 2-year survival rate of cracked tooth which has gone through root canal treatment was approximately 90%. To talk about survival rate, if the PPD was over 6 mm, it was 74.1%. If it was below 6 mm, it was 96.8%. Therefore, providing endodontic treatment to a cracked tooth can provide a favorable prognosis, and I hope more accurate prognosis can be determined through additional research on the factors that affect the cracked tooth. Thank you.